name's Bridget and this is my day in the life. So my name is Bridget and I'm a nursing assistant at Croydon, and at the minute I'm also helping out with some of the admin work in the hospital. So at the minute I'm based primarily on Reading ward. For the past month I've been working on Reading as nursing assistant and also helping with the admin on the ward as they're without a ward clerk. Reading is an escalation ward, so it's only just been set up to cope with the demand of COVID on the hospital. But aside to Reading, I'm also working in ICU on weekends, and at the minute, because I'm actually now back at uni, I'm just coming in on an afternoon to help out. On a day-to-day basis across the wards, my main role is helping the nursing staff and helping with washing, feeding, generally caring for the patients. It could include doing ECGs for the doctors and things like that. And then on the admin side, that includes looking after the discharge paperwork, booking transport, booking transfers between the wards if a patient needs to move. And it also includes booking follow-up appointments for patients after they've left the hospital and putting that aftercare plan in place. So I would say Croydon chose me rather than me choosing them. At the start of the pandemic back in March, Croydon were actively recruiting for cabin crew, and a lot of other hospitals weren't doing that. I unfortunately lost my job with the airlines back in March, and Croydon kind of welcomed me with open arms, and they were keen to take on airline staff because we already have a basic knowledge of healthcare and a basic level of first aid and security awareness and things like that. So that's how I ended up in the role. Coming from the airline into the hospital, it was a really big change, and I remember the first time I was responsible for giving patient care, a lady asked me to take her socks off, and I was like, wow, that is actually quite an invasive thing to do, to take somebody else's clothes off. And actually just from that point it just started getting easier, and you kind of become one with the job and you realise that what you're doing is really helping somebody else, so you break down those barriers of this is someone else's personal space, or I'm helping somebody with the most personal parts of their life, like going to the toilet and washing and things like that. But you just soon break down those barriers, and in a way on an aeroplane you're in a really confined space with other people, so you've already broken down that personal space barrier, so that really helped. So I'd say COVID doesn't affect the role I'm doing at the hospital, because I've always worked in this role and always known COVID, because I was recruited to help with the COVID pandemic, and it did however affect my original job. So obviously I lost my job as cabin crew because of COVID. In terms of my personal life, unfortunately a couple of months ago I lost my dad, and oh god, I don't think I get upset about it, but
take your time.
Yeah, that was really hard, so I'm hoping that I can help other people avoid being in that situation. I think like when I thought about coming back to the hospital, I thought this is going to be quite hard, and I was like, is this the right thing for me to do, because this could stir up some emotions. And actually coming back, it's been really, really good, and I think it's a bit of closure for me. And like I said, I'm glad I'm in a position where I can then help other people and hopefully help prevent a situation where another family is kind of broken up because of COVID. All of Croydon is like one big team, and it doesn't matter if you're a nurse or a doctor or a matron, everyone kind of chips in and everyone helps each other. And I think we all understand what each other is going through, whether that's like burnout or stress from the job or personal circumstances. I think everyone understands that everyone else is having a really rubbish time, so everyone's very supportive. I mean, the hospital as a whole, with things like wobble rooms and free food at lunch and dinner. That's always helpful. People love free food. And I think there's a lot of support in place that are helping people, just little things helping people to get through like a really rubbish time. Sometimes I come out of work and I'm just like inspired by what I see my colleagues doing, like other nurses and doctors. They're doing amazing things and that's their full-time job, and I really admire what they do. And sometimes I come out of work and I'm like, wow, I want to be a nurse or I want to be a doctor. I ended up here because I started out in a job where I wanted to travel the world and experience different cultures and things like that. And actually, although I've not physically done that, I'd say I've definitely emotionally done that. And Croydon's such a diverse area that there's like, I don't know, something like over 100 languages spoken in this community. And it's like, I've not experienced the world physically, but definitely every shift I'm on, I meet people from a different country and different cultures and learn so much about the world just on my doorstep in Croydon. So yeah, that's what makes me proud to work at Croydon.
No, she's nice. I know she's going a bit red, but I mean, apart from that, she's all right. So
There you go.
anyway,